Hello, I'm Dr. Crystal. Welcome to my show. Thank you so much for joining me today. I'm so glad that you're here. Because of you, I can do what I really love to do, which is inspire people and just basically give some kind of light to them, in sometimes, dark situations. So today we'll be talking about infertility and I'll dive right into it. What are some things I'll talk about today? Basically, just give a simple non-medical term of what infertility means. I'll also talk about, say, what can cause infertility. I'll talk about things, that we can do while doing our waiting period and things that might be, helpful to avoid doing. And then apart from that, I'll also talk about, you know, things to say and things not to say, to people waiting for, their blessing. And also basically, if you wait till the end of this, I probably would give some kind of, special talk to, people, waiting and just see, if there any way we can, any advice or anything I can give, to help. Obviously, speak to your own doctor. I'm not here today as a doctor, even if this, because this is a medical topic, I'm dressed in my scrubs just so I can look like a medical bit. But basically, speak to your own doctor and please drop your comments here. If you've been through the journey and anything that helped you, please drop. I'll also drop a few comments of mine. It might be this is a community where we lift each other up. So please try to lift someone up today before, you leave the community. And also in your real life, please try to also be a blessing to someone today. Sometimes we have no idea what people are going through, and it's really up to us to make sure we leave the world better every day. Okay, so right about it. What do I mean by infertility? Just just something simple. When you haven't been able to have a child, when you're waiting, actively trying to have a child, and the duration of this can depend. Sometimes you can see 6 months, maybe depending on your age or if there are any other medical comorbidities or condition, that the person might have. There can also be, we can also say well, if it's longer than a year, but basically just speak to your doctor and they'll let you know if it's the right time to be worried. Or and why we give it time is because for majority of people, they get pregnant with time, they just by waiting and by trying, and it might not be anything. Then what are some of the causes of infertility? There's the female factor, there's the male factor, and there's something we call idiopathic, meaning like we can't find a reason why everything seems to be fine medically. And I know some people might find that quite, daunting and disturbing more than if there's something, okay, I'll fix it and have a baby. But when everybody's saying, oh, there's nothing, you're like, okay, so what's going on? I know that can be quite, but hopefully everything will be fine. And then for the female factors, there are things like obviously medical condition, around the tract of the baby, like where the baby and what we call the female reproductive, side organs and things like that. So just some people might have, just talk about some common things. Some people might have things like, you know, um, PCOS. So what we call polycystic ovarian syndrome. Some people might have that. I wouldn't be going into details now, but just sometimes there might be things like, maybe facial hair, abnormal facial hairs of hairs where you wouldn't expect as a female. Maybe you're gaining weight when you're not actively trying to gain weight. Your periods are something, you don't see your periods the way you should, or things like that. Then also there's endometriosis. Basically, it's just a fancy name for when the uterine tissue is present outside the uterus. So don't worry about that. But basically, it's just telling you when sometimes some things that can happen. So if you notice maybe you have maybe a child or you have a friend or someone that maybe has really, really abnormal, painful periods, or their periods are so heavy, they feel dizzy, they're usually like anemic, they have to use so many pads because they keep staining themselves. It could be physiological, it could be normal, or it could be, they just need to maybe speak to a doctor just to be sure there's nothing they can do to, it's not something to be concerned about. So that's that. Then apart from that, there's also when there are problems with the woman's cycle or sometimes some medical conditions. That's why if you go to see your doctor, they can tell you to do simple tests like checking your thyroid, which is one of the glands on the neck, because if it's abnormal, it can affect fertility, things like that. There could be where people have maybe eating disorders, something we might call anorexia nervosa, where they may have lost so much weight and it's affected their metabolism, which is the way their body functions, and they might not have even seen their period for a while, so the chances of pregnancy might be really slim. So things like that can actually happen. But like I said again, speak to your doctor, and he or she will probably be able to advise you, better, and make a plan specific to you. And then for male factors, there are things like azoospermia, which is when the man might be producing sperm, but there's no active um, semen, but there's no active sperm in it that can actually go to the egg and fertilize it. So there are treatments for that. Many of those things are treatable, so don't be, overwhelmed by them. But it's good to know what exactly you're dealing with and see how you can get the right support for it, if that makes any sense. But yes, there could also be things like maybe untreated or poorly treated STDs, sexually transmitted diseases in the past, and things like that, can maybe just treating them can make a lot of difference. And then there could be things like, for some people, they may have their procedures that they can do as a form of contraceptive, to disrupt the anatomy of the male or the female, and that could maybe in the future they might want change their mind and want to have a baby, and some of those things might be irreversible and it might be difficult. So there are 1,001 reasons why people might be going through the journey of infertility. But I'm hoping for you to be listening to this. You might want to maybe trusting for a baby or trusting for a baby for someone. So basically, what then there's, like I said earlier, there's just no known cause. We just don't know why this is happening, and there's so many other reasons. This talk wouldn't be exhaustive enough to address all of them. But what can we do while we're waiting? I think the first thing to do is, when we see infertility or having unprotected sexual intercourse, because some people might be using condoms and they're wondering, oh, I don't have a baby. That's the aim of the condom, to prevent that. It's like a contraception. But I'm kidding, but I'm just trying to say, and then having what we consider enough sex to be able to say, oh, you're doing enough, is like 3 times in a week, every other day. Because the thing about the sperm is, when it comes, ideally we want the egg to be, once you ovulate, that's when the egg, you're in that period of your cycle and things like that. We want the sperm to be there waiting for the egg. So once the egg just drops, the sperm just sharply shoots, if you get what I mean. So we just want to make sure that you're having sex the right frequency. So obviously, and then you're not performing in any, sexual activity that might be impeding this act. For example, some people might use, spermicides, which is maybe you're using some lubricants or things like that that might actually be harming the sperms. But anyways, just speak to, your doctor, and they will probably be able to guide you better. But just making sure you're practicing safe practices. And then some people may be wearing, people that cycle a lot, that might affect the temperature around that area, or maybe some particular boxers or clothing, might, interrupt the spermatogenesis, the forming of sperm and things like that. But not to be too technical, basically. So some of the things that we can do while we're trying to have a baby is just keep a cycle. Some women, I didn't really know this before, so this is not shade on anyone. It's just, that's why we're here to learn together. Might not really know the best times that increases their chances of getting pregnant. And you can just check the internet. You can check the channels on YouTube. That's not what this video is about. You can read books. You can just some people have regular cycles. So maybe they bleed every maybe 4 days, every 28 days, or every 30 days, or the first day of your cycle is the first day you bleed. Ideally, let's say you have 28 days. We say by day 14 you should have, ovulated around that period. So from day 10 to say day, maybe day 16, just be giving it back to back and make sure the sperm is there waiting. But there are kits that monitor all of these things. You can get the kits that monitor your ovulation, that monitor this, that monitor that, or you can just do it the natural method, just calculate. So you might want to speak to like a medical professional about this, and they'll be able to guide you further. But it's important that we're doing the basic things ourselves, the doing what we can do to help make this process more seamless, if you get what I mean. And then apart from that, things like, doing the right practices, not doing anything that is harmful, or even just our lifestyle, just not being too anxious, not being too worried. It can be quite difficult, I know, but just trying to make sure that our mental health, our physical health, some people might need to lose weight, some people might need to gain weight, just doing things within your sphere of influence, things you actually can control, can go really, really long. Some people might just something as simple as maybe changing your diet, or including this in your diet, just simple things like that might really be helpful. Then apart from that, simple blood test. Some people might just realize that, oh, if they've done this test, they see that maybe one of their hormones are low or high, and they might just get treated for that. So just simple test, just actually finding out what is actually wrong, what the diagnosis is. Is there anything wrong in the first place? And I know we have this thing. Sometimes there's this cultural thing that thinks, oh, is the woman that has a problem. No, 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 no. Infertility, male and female factor, is both parties. For research have shown that. So I think just get checked out, and don't, we're not actually supposed to blame anybody anyways, but don't, at least get your information right. We all need to get the information right. So basically that's what this, I hope, leads us to, just provide more knowledge for that. Then apart from that, just some people might have a sexually transmitted disease, either from their past, from their present. This is not about blaming each other. It's just about trying to figure out how best to treat this and just move on. And sometimes that might be all we need to even get to have our baby. So just doing the basic things. I want us to be doing that. And then a couple of things to do while we're waiting for, our baby. One of them is do what you can control. Some people, you might not be able to control when you have a baby, but you can control how you protect your space. Just because you're waiting for a baby is not a time, doesn't mean, or is equivalent to you being disrespected. Women, protect your home, protect your man. Men, husbands, protect your wives. That's not the time to leave the door open for everybody to have an opinion when they really don't even know what's going on. And I'm not talking about, it's important that we seek the right guidance, the right advice, let the right voices speak into us. But for many people, it's a time where people might be low, and you just want to make sure that you're getting the right, healthy input into your life, into your spirit, into your soul. That's not a time to, listen to things and hear things that will probably tear you apart. I know many of us have heard about infertility, but I've walked that journey. Thankfully, I came out of the other side really successful, and I'm so thankful to everyone that made that possible. God, family, doctors. And I'm not trying to undermine the journey here, but I'm just trying to say that you need to be healthy to actually have a baby, right? Mentally, physically. So you need to protect that space, and you need to guard it. Beyond that, secondly, you want to be able to progress. Just because you have a baby, you're waiting for a baby, that doesn't mean that, every other area of your life means nothing. And I'm not here to tell anyone how to deal with their issue, because everyone is different. Everyone's situation is different. For some people, maybe they think what's best for them is to keep the rest of their life on hold until they have a baby. And that's okay if that's what you want. But I think I'm speaking in this particular point to people who that's not what they want, but they don't know how to come out of it. You actually want to be able to progress in your career. Thankfully, I was able to do that. I had already become a doctor, obviously got married, trying for a baby, and it didn't work. Not 1 year, I waited for a baby. Like I waited, and but I tried to keep my head up. And there were days that it was difficult. There were days that I cried that my pillow was not enough to comfort me. And I understand that there can be difficult days. There can be, there can be times where you don't even want to talk about it. Maybe for some reason being quiet about it hides you from facing the harsh reality of having to wait. But to be honest, there's more to life. The world is not stopping because we're waiting for a baby. Take all the time you need, but whenever you're able to, get up and fight. You're a powerhouse. You got this. seek all the help that you need. But at some point, you actually need to, so, realize that you have to pay the bills. You probably have to go to work, like most people, except maybe you're from a really comfortable, wealthy family. Or please don't bother, just watch Netflix. But if you're like the rest of us humans, you have to go to work, right? And you have to work really. Sadly, don't really care. I remember being in obstetrics, one of my rotations, where you have to help people deliver, that's women health and things like that. And there was a time, I think probably I was assisting in theater several times, and I didn't have my baby then. So you have to face situations that you might, if you had to choose, you probably might not want to be there. Some people might work in a department where they have to work with babies every day, and they're like, would I ever hold one and call that one mine? I understand your pain, but this life, you have to get up and you have to face life the best way you can. And you need to take breaks when you need it, but don't let your life itself become a break. Then something else that you can do is you can actually, use this period, enjoy this period. I know it doesn't sound like there's anything to enjoy in this period, but trust me, there is. You can actually wake up, decide, oh, I'm going on a holiday, get your bag and go. You're not thinking of that little cutie that, needs me to survive, needs me to be alive. No, you actually can just do what you want to do. Obviously, maybe you have a partner, but I'm hoping your partner is not like dependent on you for everything. And I know there's some people that might have partners that maybe have special needs or things like that. That's not what I'm talking about here. I'm talking about people that, your partner is able to do things for themselves. And you have to focus on yourself. This is the time to enjoy this period. Some people use this period to learn new languages, learn new skill. Okay, I'm smiling because I've been trying to learn how to sew since forever. I still have my machine, so maybe I'll get back to it. But you can use this period to, invest in yourself. Learn what it actually is to be a mother. So when that baby comes, you're like, you really can never be equipped enough, but at least you have some tips on your fingers. But my point is really just use this period to grow. Use this period to spend time with family, spend time with friends. Use this period. Some people might want to go back to get that first degree they never got because maybe life happened, they couldn't afford it then. Some people might want to go for their masters, their PhD. Some people might want to actually change, completely relocate, like completely change your life 360 degree. Like this is this time. You would not always have this time. So use this time well. I remember when I was waiting for a baby, I was really doing well with my training. And I remember speaking to someone who told me, oh, like, well done, that while she was waiting for her baby, she couldn't do anything other than wait for that baby. Years passed, things passed, but she was just waiting for that baby. And she said it to me like from a place of, I wish I did things a little differently. That's what I understood at least. And so that's why I'm doing this video, so that you can, you make better choices, be well informed that this too will pass. You've probably been through difficult times. This is just one of them. I know it seems like it's taking so much time, it's taking forever. Would it ever end? Like, I will feel better if I knew when it will end. Like, okay, I knew that, okay, you're just going to wait for 5 years after that, you're going to have your babies. It will be a lot easier to carry. I understand that. But to be honest, none of us really know the future. All we have is today. And we really need to make sure we're doing the best that we can with what we have, just so that we're not going to be like that one that never really used the talent because it was just one. That we just think to bury. No, it's not okay. We have to get up and we have to do what we can. We have to carry that pain. It might be heavy. I'm not saying that, it's not heavy. It might be really heavy, but we can carry it. And by the time we look back someday, the journey would have been beautiful with all of those weights. And then we'll look at our precious ones and say, come here. I waited for you so long. But anyway, see what mama, see what papa did while we were waiting. So something else that you can do while you're waiting is surround yourself with the right people. I know the world is harsh. I know the world is cruel. I know people just really don't care. People might be talking, but if people live their lives, they leave their problems to talk about you. Oh man, you're probably gold. My point is, it doesn't matter. It won't matter in the scheme of, in the big scheme of things. It won't matter with time what they said or what they didn't say. Don't get in yourself into those little banters. Focus on your life, on your journey. And it will happen for you. It will happen. I strongly believe that it will happen. So basically, while we're talking about things to do, I would just want to talk about things, not to do. Don't let this create such a distance between you and your partner. I've spoken to several people that have gone through this journey, and sometimes there's just this barrier. That's probably when they're having a misunderstanding, when it's time, when they're ovulating, when they actually should be meeting. Like, there's just this animosity that shouldn't be there. And I understand that sometimes no one plans for these things, but that's why I'm having this. Don't let anything take any more from you than what this infertility is actually taking away from you. Just try as much as is within your power to just be joyful. I know there might not be anything to be joyful about, but just be joyful that you're alive. Some people have no business with infertility. They're in the hospital, they're on oxygen, they're actually fighting to be alive. They would pray to be in your shoes. I know you don't believe me, but I'm serious. And you have to be sure that you don't become a bitter person. You don't just, some people have cut off every meaningful relationship. Why? I walked that journey. It's painful. You don't forget the smell of infertility if it has one. You don't forget its grip. You don't forget these things. Like, you don't. So I know it's real. I'm talking from a lived experience. I understand. But no, don't do that to yourself. You need some of these meaningful, and I didn't say every relationship. I'm talking about meaningful, healthy ones. People that love you with or without a child. You just can't close that door. Some people, they haven't even been to any community just because they can't just stand seeing other people have babies. Like, I know it's difficult, but there's something a sister of mine used to say. She says when the good things happen to people, then she tells herself, oh, I need to be happy. God is in my neighborhood. And it was someone that told her that. So my point is, I know it's difficult, but you can still be happy for other people, while you're, waiting for your own miracle. Something else that probably you shouldn't do, is, just keeping your life on hold. Like, I now talking about this, I know a couple of people that maybe bought houses while they were waiting. There's one particular person in my mind, this couple, they probably got a 4-bedroom duplex. There was not baby in it, like, even in the picture, if I'm correct. But when the baby came, I'm like, oh, we have to relocate after maybe a year or so, like we need something bigger. My point is, when that baby comes, that baby will thank you that you did something with their waiting time. Some people, this is the opportunity, that they probably, go back to further education to put themselves in a better position to get a better job and get more pay to be able to give that child they're waiting for. Childcare is expensive, especially if you live abroad. It's expensive. Even if you live in, back home, my beautiful Nigeria, you have to pay for maybe nannies, maybe childcare, maybe a driver. My point is, it's not cheap. And so this is the time to position yourself the best way you can, so that when these things happen, you're in a better position to give this beautiful child at least some sample of an okay life. And then apart from that, just basically things that you shouldn't do, right? Don't just believe those lies you tell yourself. See, I can do something about the lies that people tell you. You just shut the door. But you see the lies that you tell yourself, the lies that I tell myself, I'm not sure what I can do about that. That stronghold, that belief I'm not good enough. There's something wrong with my anatomy. There's something wrong with my body. There's somebody doing this to me. This is about this. This is about the mistake I made. It's about the abortions I committed. It's about virgins. People that married virgins are looking for children. Just to put that in. It's probably not about that. And even if it's about, there's restitution. You can actually it will be okay. Like, just don't, it's heavy enough as it is. Why put in other weights that may or may not be correct? I'm just trying to say basically that we just have to look out for ourselves. Like, don't entertain some of these things. Just put structures in place to confirm your own narrative of maybe why you're still waiting. And then apart from that, some people just, zero out on life. Like, they're just existing, they've stopped living. And I understand that sometimes the wait can be long. The night can be long. But see, the darkest part of the night are usually when it's about to break. And while we're at it, I want to talk about several ways to motherhood. I know lots of people want to be mothers biologically. I understand that. You want to carry your own. You want it then to be genetically linked to you, and that's fair enough. We all want that. But there's adoption. And an adopted baby is just a good baby. Is that right in English? Anyway, it better be. And then there's surrogacy. Some people cannot carry their baby. They just can't. There's medically proven reasons why they can't. They've seen the doctor, and the doctors have told them to get surrogates, but they're like, no, I rather remain without a child. And that's okay, because I'm going to get there. Not everybody needs to have a child. You're whole just by being you. So you don't need a baby to complete you. Nothing of that. But if having a baby is what you want, then there are other routes to having a baby. That's just all I'm saying. There's IVF, in vitro fertilization. There's ICSI, which is a more specialized form of IVF, where they actually get the egg and the sperm and they mix it for you. They're not even waiting for the sperm to swim to the egg. There's so many more things, so many more ways to have a baby. And I want you to at least try and know about them. It's okay to know about them and say, no, I don't want them. That's okay. But at least get the right knowledge. Because, people perish for lack of knowledge, right? So don't be among those that are ignorant. Don't choose ignorance. Ignorance is so expensive. You need to get that knowledge. So at least you know what you need to do. And then it's up to you to say, I want to do it or I don't want to do it. But at least know it. And then apart from that, something else is if I remember anything else, I'll put them down in the comment section. Just because of time, I'm trying to round up things not to say to people looking for a baby. To be honest, I really can't think of any now, but I'm sure you probably help me out here in the comment section. Things not to say to people looking for a baby. Oh, I would do this if I were you. No, you're not them. And you really don't know what you would do if you were them. You're not in that shoes. Even if you've walked that shoes, your shoes might be Gucci. Theirs might be, call another designer, please. So it's still shoes, but it's not the same. Like, my point is, you really don't know what you would do if you were them. You don't have the true picture of anyone's life. You only see what they want you to see. You really don't know what's going on behind closed doors. You can only know someone as well as they want you to know them. So my point is, don't just give unsolicited advice. And even if the advice is solicited, dish it out with grace, dish it out with mercy, dish it out with just a pinch of love. Because life can really be hard on the journey of infertility. I don't think any waiting mother needs any judgment. And you have to toughen off your skin if you're waiting. You just can't think, oh, people will be nice. No. The world is tough. You have to toughen off your skin. And if you're a softie like me, oh, everybody to understand, I like love, but you have to toughen off your skin at some point. If not, you just be like a house without walls, where everybody just comes in and, and that's not what you want. You deserve better. That's the point I'm trying to make. Even you are not allowed to treat yourself bad. Okay? Okay, I'm trying to put some humor in it. I know it's a dark journey for some people, and I understand that because it was a dark journey for me. And I'm one of the strongest people I know, but only very few things have broken me in life successfully, and that journey was one of them. And I'm so thankful to God that I've come out so beautiful. And I want you to know that I believe the same for you. So if you have any questions as I round up regarding infertility, drop it on the comment sections. And if you know you're in a position to help someone around you, this community, both online and offline, is a community where we lift each other, where we support each other, where we love on each other. So if you know someone around you, after listening to this, please forward it to them, obviously. Subscribe, like, oh gosh, how could I forget to say that? But that is going through something, reach out to them, take them to a hospital. If you're a medic, and you're able to offer like a free test or something, or just able to offer free counseling, please reach out to people within your circle. Sometimes this journey is such a lonely one that people might actually be timid and terrified to actually reach out, but they will be so grateful if people reach out to them sensitively and in love. So anyways, as I come to the end of this, thank you so much for giving me your time. Like, I'm so grateful. Have an amazing, amazing, amazing week until we meet again. Love you loads. Bye.